Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Structured exercise after adjuvant chemotherapy for colon cancer. Background. Preclinical and observational studies suggest that exercise may improve cancer outcomes. However, definitive Level 1 evidence is lacking. See A.I.O conclusions. A 3-year structured exercise program initiated soon after adjuvant chemotherapy for colon cancer resulted in significantly longer disease-free survival and findings consistent with longer overall survival. Next article. Tirzepatide as compared with semaglutide for the treatment of obesity. Background. Tirzepatide and semaglutide are highly effective medications for obesity management. The efficacy and safety of tirzepatide as compared with semaglutide in adults with obesity but without type 2 diabetes is unknown. Conclusions. Among participants with obesity but without diabetes, treatment with tirzepatide was superior to treatment with semaglutide, with respect to reduction in body weight and waist circumference at week 72. Next article. Neoadjuvant and adjuvant Pembrolizumab in locally advanced head and neck cancer. Background. The benefit of the addition of perioperative pembrolizumab to standard care with surgery and adjuvant therapy for patients with locally advanced head and neck squamous cell carcinoma, HNSCC, is unclear. The addition of neoadjuvant and adjuvant pembrolizumab to standard care significantly improved event-free survival among participants with locally advanced HNSCC. Neoadjuvant pembrolizumab did not affect the likelihood of surgical completion. No new safety signals were identified. Next, we will be discussing articles from Journal of American Medical Association. Lorundrostat in participants with uncontrolled hypertension and treatment-resistant hypertension. The Launch-HTN randomized clinical trial. Question. Is the aldosterone synthase inhibitor Lorundrostat more effective than placebo in reducing blood pressure in participants with uncontrolled hypertension, including treatment-resistant hypertension, taking 2 to 5 prescribed antihypertensive medications? Findings. In this randomized clinical trial, 50 mg of Lorundrostat once daily significantly reduced automated office systolic blood pressure by 16.9 mm Hg versus placebo by 7.9 mm Hg, at week 6 in participants taking 2 or more prescribed antihypertensive medications. Lorundrostat was associated with a low incidence of hyperkalemia and was well tolerated, meaning these data support the use of Lorundrostat as a treatment option for participants with uncontrolled hypertension, including treatment-resistant hypertension. Next, we will be discussing articles from Annals of Internal Medicine. Risk for stroke after newly diagnosed atrial fibrillation during hospitalization for other primary diagnoses. A retrospective cohort study. Background. Atrial fibrillation, AF, that is first diagnosed during hospitalization for other causes can subside with resolution of the inciting stressor. Conclusion. Among patients with newly diagnosed AF during hospitalization for other causes, a substantial proportion with low CHA2 DS2-VA scores receive anticoagulation, with modest increases in this proportion at higher scores. The stroke risk in patients with CHA2 DS2-VA scores greater than 4 approximated the 2% threshold commonly used to initiate anticoagulation in AF. Next, we will be discussing articles from British Medical Journal Global, Regional, and National Characteristics of the Main Causes of Increased Disease Burden due to the COVID-19 Pandemic. Objective 2. To quantify and identify the main causes of increased disease burden due to coronavirus disease 2019, COVID-19, pandemic. Conclusion. The COVID-19 pandemic significantly increased the burden of several non-COVID conditions, particularly mental health disorders, malaria in young children in the African region, and stroke and ischemic heart disease in older adults, with notable disparities across age and sex. These findings underscore the urgent need to strengthen health system resilience, enhance integrated surveillance, and adopt syndemic-informed strategies to support equitable preparedness for future public health emergencies. Next, we will be discussing articles from Lancet. Surgery versus corticosteroid injection for carpal tunnel syndrome, districts, an open-label, multicentre, randomized controlled trial. Background. Surgery and corticosteroid injections are established treatments for carpal tunnel syndrome, but the optimal treatment strategy remains unclear. This study aimed to compare starting treatment with surgery versus starting with a corticosteroid injection interpretation. In patients with carpal tunnel syndrome, initiating treatment with surgery offers a higher chance of recovery after 18 months compared with starting with a corticosteroid injection, even with the possibility of additional interventions. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Non-contrast magnetic resonance imaging versus ultrasonography for hepatocellular carcinoma surveillance, a randomized, single-center trial. Background and aims. This study aimed to compare ultrasonography, US, and non-contrast magnetic resonance imaging, MRI, in the surveillance of hepatic malignancy. Conclusions. Non-contrast MRI is a better alternative to US for the surveillance of cirrhotic patients, offering earlier stage at initial diagnosis and lower false positive referral rate. Here are the articles from Clinical Gastroenterology. Esophageal expert development of a preliminary question prompt list for adults with eosinophilic esophagitis, a modified Delphi study. Background. Question prompt lists, QPLs, are structured sets of disease-specific questions intended to encourage question asking by patients and enhance patient-physician communication. To date, an O-specific QPL has not been developed for O patients' conclusion. This is the first preliminary O-QPL developed in the field of medicine. We hope implementation enhances effective patient-physician communication by encouraging patients to ask relevant questions that experts prioritized. Future studies will aim to modify this communication tool by incorporating patient perspectives. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Glucocorticoid dosing and implications for vaccination, evolution of global definitions. Despite widespread adoption of high-dose glucocorticoid definitions across international immunization guidelines, prednisone equivalent dosing greater than 20 mg/day or greater than 2 mg/kg/day in children, the rationale remains unclear. Literature searches were performed through academic databases for this narrative review to identify relevant evidence regarding glucocorticoid dosing on vaccine responses and safety. In people receiving prednisone less than 7 mg/day, vaccine responses are maintained. In people on high-dose glucocorticoids, greater than 20 mg/day, antibody titers and seropositivity are reduced, whereas the impact of low to medium-dose glucocorticoids, 7 to 20 mg/day, on vaccine efficacy remains inconclusive. Due to inconsistent pediatric dosing regimens, data is insufficient to support a unified high-dose glucocorticoid threshold. Non-live vaccines are well tolerated in patients receiving glucocorticoids with rheumatic/inflammatory disorders, but enhanced reactogenicity after live vaccination may occur in those with severe immunodeficiencies. Clinicians should consider individual risk-benefit profiles, rather than following strict dosing thresholds, when curating immunization programs for patients prescribed glucocorticoids. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Association of Cloto and Gout in Middle-Aged and Older Adults, National Health and Nutrition Survey, 2007 to 2016 background. Cloto, which is known to negatively regulate metabolic disorders and kidney disease, has a role in gout that remains unclear. This research explored how cloto levels correlate with the prevalence of gout. Conclusions. This research found a negative correlation between serum alpha-cloto concentrations and the occurrence of gout. Those with the highest levels of cloto exhibited the lowest likelihood of gout, indicating potential importance for future studies and clinical uses. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. FMO2 prevents pathological cardiac hypertrophy by maintaining the ER-mitochondria association through interaction with IP3, R2-GRP75, DIOC1. We observed FMO2, flavin-containing monooxygenase 2, reduction in pathological myocardial hypertrophy. We demonstrated that FMO2 reduction exacerbated pathological myocardial hypertrophy. We reported that FMO2 localizes to mitochondria-associated endoplasmic reticulum membranes, where it binds to inositol 1,4,5 triphosphate type 2 receptor, IP3R2, to maintain the endoplasmic reticulum mitochondria contacts, thereby regulating mitochondrial Ca2+ signaling for bioenergetics. Here are the articles from Journals of the American College of Cardiology. Long-acting factor XI inhibition and periprocedural bleeding, an analysis from Azalea-Timmy 71. Background. In Azalea-Timmy 71, a multicentre, randomized, active controlled study to evaluate the safety and tolerability of 2 blinded doses of Obesity compared with open-label rivaroxaban in patients with atrial fibrillation thrombolysis in myocardial infarction 71. Obesity, a novel factor XI inhibitor, significantly reduced the rate of major or clinically relevant non-major, CRNM, bleeding compared with rivaroxaban in patients with atrial fibrillation, AF. Obesity is long-acting with a half-life of 28 days. Conclusions. These data illustrate that patients with AF treated with abelacimab, a long-acting factor XI inhibitor, can undergo invasive procedures with low rates of bleeding. Moreover, these findings suggest that routine interruption of anticoagulation may not be necessary for all procedures in the context of factor XI inhibition, particularly for procedures that have low bleeding risk. From JAMA Cardiology. Cardiomyopathy-associated gene variants in atrial fibrillation. Question. What are the prevalence and clinical implications of inherited cardiomyopathy-associated pathogenic or likely pathogenic, CMP-PLP, variants in patients with atrial fibrillation, AF? Findings. In 2 longitudinal cohorts, including a total of 44,182 patients with AF, the frequency of CMP-PLP variants was 2-fold higher in patients with AF, and up to 5-fold in early-onset AF, less than 45 years. Patients with CMP-PLP positive AF were at increased risk of incident cardiomyopathy or heart failure, CMP/HF, after AF diagnosis. Meaning results suggest that CMP-PLP variants could be discovered by genetic testing in up to 5% of patients with AF, and could identify patients with AF who are at higher risk for CMP/HF. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Cost-effectiveness analysis comparing conventional and digital software-supported management for hypothyroidism. Background. Wearable devices can now leverage the established correlation between thyroid function and heart rate to monitor thyroid function alongside exercise levels and heart rate. The objective was to assess the cost-effectiveness of introducing a wearable/mobile-based thyroid function digital monitoring solution for the management of hypothyroidism compared to the conventional management approach. TONS conclusion. The incorporation of the digital monitoring solution has demonstrated positive cost-effectiveness in hypothyroidism management when compared to the standard care. The cost of the digital monitoring solution and its sensitivity are key factors in determining cost-effectiveness. Striking a balance among the cost of digital monitoring support, the precision of hormonal level monitoring, and its effectiveness for the specific group of hypothyroid patients in real-world clinical practice is essential. Here are the articles from Diabetes Care. Impact of islet transplantation on diabetes complications and mortality in patients living with type 1 diabetes. Objective. This study aimed to evaluate the impact of islet transplantation, IT, on diabetes complications, death, and cancer incidence. See conclusions. This study suggests long-term benefits of IT on diabetes-related outcomes. Furthermore, despite the use of immunosuppressive drugs following IT, we observed no significant increase in the risk of cancer. Altogether, these findings highlight a favorable risk-benefit ratio of IT in treating patients with unstable T1D. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Association of predicted visceral fat percentage with dementia risk in older adults, the role of genetic risk and lifestyle. Background and objectives. Obesity is a modifiable dementia risk factor, but body mass index does not account for fat distribution, particularly visceral fat, which is more strongly linked to metabolic and cardiovascular health. Despite its relevance, research on visceral fat and dementia is limited, especially in large-scale prospective studies. The aim of this study was to assess the association between visceral fat and dementia risk, its interaction with genetic predisposition, and the impact of healthy lifestyle adherence. Discussion. Among non-demented, community-dwelling older Britons, atypical VFP was associated with higher dementia risk in both sexes. The lack of interaction between VFP and genetic risk highlights the complexity of dementia pathogenesis. In addition, a healthy lifestyle may mitigate the dementia risk associated with atypical VFP levels. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Ventilator-associated pneumonia in low and middle-income versus high-income countries. Background. Ventilator-associated pneumonia, VAP, rates are higher in low and middle-income countries, LMICs, than in high-income countries, HICS. Research question. Could differences in ventilator bundle adherence, ventilation practices, and critical care staffing be driving variations in VAP risk between LMICs and HICS? Interpretation. Our results show that patients in LMICs have a twofold higher risk of VAP, independent of bundle adherence. Prolonged mechanical ventilation was an independent predictor of VAP, whereas higher staffing ratios were associated with decreased risk for VAP development. Unmeasured factors, e.g., infrastructure, infection control practices, may explain the higher VAP rates in LMICs. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Early versus delayed switching from controlled to assisted ventilation, a target trial emulation. Rationale. In critically ill patients receiving invasive mechanical ventilation, switching from controlled to assisted ventilation is a crucial milestone toward ventilator liberation. The optimal timing for switching to assisted ventilation has not been studied. Conclusions. Early switching from controlled to assisted ventilation is associated with shorter duration of invasive mechanical ventilation and ICU stay compared with delayed switching. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. High heat exposure and medical utilization among the CKD population. Exposure to days with higher heat indices was associated with increases in weekly utilization for a population with CKD. Higher heat indices were associated with a larger increase in kidney-related visits than all-cause utilization. Higher heat indices were associated with larger effects on kidney-related emergency department use for those least likely to have air conditioning. Here are the articles from Kidney International Reports. Effective sleep characteristics on rapid estimated GFR decline in adults with normal kidney function. Introduction. This study was conducted to evaluate the association between self-reported sleep characteristics and rapid decline of estimated glomerular filtration rate, eGFR, in adults with initially normal kidney function. Conclusion. Regular daytime napping, especially in older adults, may be protective against kidney function decline, whereas short sleep duration may accelerate EGFR decline in younger adults. Addressing sleep habits may aid in preventing chronic kidney disease, CKD.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.